All right, today we are talking about skin cancer mindfulness. You may be wondering what that means. Don't worry, we'll get into it. If I can get it to forward.
There it goes.
There we go. I have no conflicts of interest. This event is meant to empower you with the science and the perspective to make the difference in the war on cancer, beginning with you. The thing with cancer is that any kind of cancer, even skin cancer, it can cause a lot of fear. It can cause pain and it can cause frustration. And for those of you on the call, you may have already had a cancer and maybe that's why you're here. And maybe you've never had one, but it's just scary to even think about that. Identifying and treating skin cancer at its infancy is the greatest way to increase your chance of avoiding that pain. But even thinking about that possibility can sometimes on its own be overwhelming. So that's why today we're going to talk about skin cancer. We're going to talk about how you identify it and what you do next. So first we'll go over a little bit of the science. I am a physician scientist, so I love talking about molecules and tissue. So we'll go a little bit into the science, but I guarantee that it's something that you'll be able to understand. And one of my goals in life is to make sure to bring science to the general public. So we'll talk what exactly is melanoma, what does it have to do with the sun, and then we'll talk about how to protect yourself and how to protect others. And we'll talk about how you find melanoma early and other skin cancers and what treatment might look like. And then we'll talk a little bit about overcoming that fear that I talked about before. So if you don't know me yet, I'm Dr. Johanna B. Moore. I am the laboratory pathologist at French Hospital as well as the other Dignity hospitals in the area. I am the lab director here, and I also am the pathologist in-house. My subspecialty and my superpower is actually in skin pathology, and it's called dermatopathology, although I do everything in the hospital that has to do with pathology. I trained at The Ohio State University for medical school, and then I went on to Boston, and I did my residency and fellowship trainings at the Massachusetts General Hospital, which is a Harvard-affiliated hospital. And then I did one extra year at UCSF because I just didn't have enough training yet. And I have been in the area for about 10 years now. This is me, gosh, almost 20 years ago in Vietnam with a group of pathologists and dermatologists that I worked with. And the man in the center is Dr. Martin Mem, and he is a famous dermatopathologist and pathologist in the Harvard system. I had the great honor of working with Dr. Mem during my residency training and going with him to Vietnam to open a laser clinic for hemangioma patients. And I just think that he's such a wonderful man and such an intelligent man. And I wanted to talk a little bit about him, and it does relate to you and your skin cancer, your potential skin cancers. So in 1966, Dr. Mem with these two other men, Dr. Sober and Dr. Clark, were all working together in dermatology. And what was known in 1966 about melanomas was really not much. People knew that you could get a melanoma. It was named. They knew that it could kill you, and they didn't know very much else about it. They were very conservative. So if you had a melanoma, they would do a drastic surgery in order to make sure that they got it all out. Sometimes that meant amputation, whereas nowadays we would do a much smaller surgery for those things. In 1971, shortly thereafter, President Nixon decided that he was going to wage war on cancer. And I don't know if anybody in this room was around at that time, remembers that, but it was a really big deal. And the government gave $100 million towards science in order to stop cancer. And so because of that, what that means is that they funded a lot of different studies so that people could learn more about cancer, what it is, and how to treat it. And one of the grants that came their way was by Dr. Mim. So Dr. Mim and his colleagues submitted this grant application in 1971, and it was about how to figure out more about melanoma. And he was accepted, and so he made this paper called The Early Recognition of Cutaneous Melanoma. And this is a pivotal paper because it's the very first time that they talked about ways that dermatologists and other people could actually categorize melanomas in a way that meant something for the patient's prognosis. So they talked about the different ways that you can look at a melanoma clinically and decide if it was a melanoma versus not a melanoma. They started to talk about the reason why it's important to look on a microscope, how deep the melanoma is, because it has to do with whether the patient does well or doesn't do well. And all of those different factors all came from Dr. Mim's paper. I want to tell you a little thing about Dr. Mim that is very unknown, and it's very personal, and it's something that he told me when we were sitting at the scope together looking at slides very late one night when I was a resident. He told me that one day, it was a couple days before Thanksgiving, maybe even the day before Thanksgiving, there was so much bustle in Boston. You can see here, this is probably what it looked like. It was probably snowing, super cold, and he was getting on the T, which is what they call the subway in Boston. And he happened to sit next to a woman who had a huge cancer on her face. And being a dermatologist, and actually a famous dermatologist at that time, he had to tell her what she had. And so he told her, and she was extremely upset. And I don't know if you know anybody from Boston, particularly from South Boston, but they can be pretty emotional and very aggressive. And she yelled at him. She was very upset. She couldn't believe that he would ruin her Thanksgiving. And nonetheless, he still gave her a card to his clinic, and she stormed off, and he thought, well, that didn't really go very well. But the good news is that a week later after Thanksgiving, she actually showed up in his clinic, and he was able to help her, and she survived. The reason why I tell that story is because I feel like when you know what a melanoma looks like, or you know what a skin cancer looks like, as a physician, it gives you this very special power to help other people because it's on your skin. It's not like a lung cancer or a breast cancer where nobody really sees it. We can actually see it just by sitting next to you on a bus. And my hope is that, number one, after this talk, that you have some understanding where maybe you wouldn't have the courage to tell somebody else on a bus, but at least you would be able to think to yourself, I wonder if this is something I should take to the next level and ask my doctor about. Or you could tell one of your family members or one of your close friends, like, I think that you should ask about that. And the other thing is that, like the woman on the train, it can cause a lot of negative emotions, a lot of fear, a lot of anxiety. And in the end, whether you're scared about it or not, the most important thing is that you take that next step and you ask somebody for help. And so those are the two things that I really hope that you get out of this talk. So we want to continue the Skin Cancer Mindfulness Initiative by decreasing the presence of skin cancer in our community through better protection, earlier detection, and less fear. So you may not know this, but the melanoma incidence in the San Luis Obispo County as well as the Santa Barbara County are very high, even compared to other counties in California. You can see here that In California, the incidence of melanoma per 100,000 people is 22 per 100,000. In San Luis County, it's 42. It's almost twice as high. When it comes to death by melanoma, in California, it's 2 per 100,000, and in San Luis County, it's 3. So you can see with the red arrow that San Luis County and underneath in orange, Santa Barbara County, are actually higher than other counties in California. So because of that, it's really important to understand how melanoma happens and how to see it if it's there. First, let's talk a little bit about UV rays. So there are 2 different types of UV rays, and the reason why this is important to know is because some sunscreens only cover one or the other, and it's important to get both covered with a sunscreen. The first one is UVA. UVA penetrates deeper into your skin. You can see here that this diagram shows 2 arrows. One arrow is a little bit less long than the other arrow, and this diagram indicates the very top layer of your skin, the very topmost layer. And you can see that the line on the top that's sort of undulating is the surface. The line underneath that's more wavy is the bottom of the first layer of your skin. And these little pebbly cobblestones are your keratinocytes, which are the cells that make up that top layer. The structure that looks sort of like a tree or an octopus that's going around the keratinocytes, the cobblestones, that is a melanocyte. And melanocytes are so cool because they have a central area that processes melanin, which is the pigment that protects everything from the UV rays. And then it has all these tentacles or arms in which the melanin can go and help protect the other cells. So it's sort of like nourishing and protecting all the other keratinocytes in the skin. UVA is really important to know about because it's the one that causes oxidative DNA damage. So that's how it causes skin cancer, but it's also the one that causes age spots and wrinkles. So this is why you don't want to miss that in your sunscreen. The second one is UVB. UVB penetrates less deeply into the skin. It causes direct DNA damage, so also causing skin cancer, and it's the one that causes sunburn. So both of them cause skin cancer. UVA causes age spots and wrinkles, and UVB causes sunburns. Here's a depiction of the center of a melanocyte, and you can see that it's spreading out and it's protecting all of the other keratinocytes. Here are real-life examples of melanocytes that have been stained red for you. You can see that they all have tiny little tentacles coming out. The melanocytes on the left side seem to be staying on that bottom layer of the first layer that I was talking about, the epidermis. On the right, the melanocytes seem to be a little more higgledy-piggledy. I don't know if that's something that you can appreciate. Instead of staying along one layer on the base, they're kind of spreading all over the place. And the reason why is because the one on the left is a benign pigmented area and the one on the right is melanoma. So that's how somebody like me would decide whether there's a melanoma there or not. Okay, so the keratinocyte microparasol. Keratinocytes have something. Can you hear me?
Yeah, sorry about that.
Okay, that's all right.
Okay.
Okay, so here you can see this is a similar picture with on the left a benign, banal pigmented area on the skin, and on the right is a melanoma. Both have pigment. The one on the left has maybe you could see, say, a little bit more of a symmetrical pigment on the one on the right is pigment sort of everywhere like a crazy party. But what I want you to focus on is the brown pigment that you can see. It's surrounding cells, and if you were to look a little closer, you would notice that a lot of the pigment is actually above the dots or the nuclei of the cells. And the reason why it's a parasol protecting the cells from the sun that way is because the nucleus is where all your DNA is, and that's what gets damaged and causes cancer. So Mother Nature has made this amazing, intricate system just to be able to protect you from the sun. I don't know, maybe it's more exciting to me than everybody else here, but I think that that's just completely amazing. So what happens when you don't have melanin? This is Tony the pony. Tony the pony is an albino pony. He has no melanin in his skin, and you can see that he has white fur, white skin. Unfortunately, because Tony the pony is an albino, he's highly susceptible to get skin cancers. And you can see on his eye right there, there is a pink tumor, and that was biopsied and ended up being a squamous cell carcinoma. There's Tony the pony. And this is the live view of keratinocyte microparasol with the pigment. Okay, so let's talk about protection from UV rays. We want to, number one, limit your sun exposure. Number two, add in sunscreen. And number three, use protective clothing. These are all recommendations that have come from the American Association of Dermatology. I do my best to practice them. I'm going to say something that is probably not appropriate from a dermatologist, but I am not a dermatologist, I'm a dermatopathologist, and that is that sometimes you just have to live your life and do the best you can. But I do recommend that people try to stay out of the sun between 10 and 2 o'clock. These are my children, Max and Mia, and they have skin cancer mindfulness because they take care of their skin and make sure that they put on SPF. And Tony the pony has SCM because he has a face covering that he uses to try to protect himself from getting another skin cancer. So how do you select a sunscreen? You hear all sorts of crazy things about sunscreens these days, but I'm just going to tell you that the fact of the matter is it doesn't really matter when it comes down to it. The only thing that matters is that you're using a sunscreen. I am a mom, as you can see, and when my children were young, I was very careful about what type of sunscreen I used and that it didn't have any toxins in it. But when it comes down to it, the amount of toxins that you're going to be exposed to that way is so much less than the amount of toxins that UV rays produce in your body. So no matter what, it just doesn't really matter when it comes down to it. But let's talk a little bit about specifics, just in case you don't believe me. So what you want to look for, as I said before, is that you want a broad spectrum sunscreen, something that covers both UVA and UVB, because as we saw, you don't want wrinkles, you don't want a sunburn, and you don't want to get cancer. You want it to be SPF 30 or higher. Anything over 50 is sort of a minute difference. So I usually try to go for between 30 and 50. Sometimes sunscreens just have 70 and you just go for that. You want it to be water resistant. The difference between water resistant and very water resistant is that water resistant sunscreen has been shown to last for 40 minutes in testing, and very water resistant has been shown to last for 80 minutes. So then there are chemical sunscreens. Those are sunscreens that absorb the UV rays so that they don't get into the skin. And then there are physical or mineral sunscreens, and those sunscreens deflect. And then you could get sport, and those are just basically water resistant. You can get baby, and those are the blockers, the non-chemical ones. You can make them hypoallergenic. You can get them without fragrance, and you can get camping. But the thing with camping sunscreen is that a lot of times camping sunscreen has bug repellent and sunscreen, and you just don't really want that because you're only supposed to apply bug repellent, I think, like once a day, but sunscreen you're supposed to apply all the time. So you just don't really want to combine them. So as I was talking about before, is sunscreen dangerous? Well, it's a debate that's going on and on. But like I said, I really truly feel like the amount of sunscreen that you actually use is less than you really should be, and it probably isn't going to cause any damage. But if you are worried about it, there actually is a system that they use in order to rate the minerals and the ingredients in sunscreens. So they're called the GRACE, the generally recognized as safe and effective sunscreens. So those that are completely safe are the mineral sunscreens, titanium dioxide and zinc oxide. A lot of times those are seen in baby sunscreens, or if you follow like the more natural skincare lines, that's what would be in those. Non-GRACE would be PABA and toluene salicylate. And the FDA is currently calling for more data on 12 other chemical sunscreens before they ban them. The other question that I get a lot is sunscreen killing the ocean? Well, a lot of things, unfortunately, are killing the ocean, and many of them have to do with humans, but we do the best that we can. The Hawaii governor signed legislation banning sunscreen with oxybenzone and oxynicosate about 3 years ago now. And the reason why is because there were some tests that were performed off of the barrier reef, and they took the reefs and they put them in tanks. So they took them outside of their normal habitat, and they put them in tanks, and then they exposed them to these sunscreen chemicals, and lo and behold, they turned white and died. So there's some people that believe that that is enough evidence in order to, never use them and try to protect the reefs that way. Other people believe that, you took them out of their normal atmosphere, and it was sort of what they call an in vitro experiment. And they're not really sure how much data you can actually trust from that. But what I think is that if you can stop using it and people can still use sunscreen, then why not? Better be safe than sorry is my opinion. Okay, so going back to skin cancer mindfulness itself. Mindfulness is a term that is thrown around all the time, and people think that they know what it is, but really most people don't know what actual mindfulness is. Mindfulness is a term that was coined by Jon Kabat-Zinn in the 1970s or maybe early 80s. He is a scientist out of Boston who decided that mindfulness, as it's used in the Buddhist tradition, can really help people, especially patients who are dealing with chronic pain. And so he decided he wanted to bring it to the hospitals. And when he did, he knew that he wouldn't be treated seriously unless he actually made it into a scientific study. And so he started studying what mindfulness does to patients with chronic pain. And he showed over the course of the past 30 years that mindfulness is actually a thing that works. And now there's like thousands of articles that come out every year about mindfulness, scientific articles. So what mindfulness actually is that you're paying attention to something in the present moment without any judgment. So you're allowing yourself to observe something as if you had no skin in the game about it. And the reason why I bring it into this talk is because I believe that often it's easy to ignore something if you judge it. And so if you're paying attention in the moment to something on your arm, and you think in your head, I wonder if this is a cancer, some people will act on that and try to find out. Some people might ignore it for a really, really long time. And so if you consider that reaction when you see it and you stop yourself and you say, no, I just want to get more information right now, that could save your life. So let's talk a little bit about what skin cancers actually look like. I'm going to show you some pictures and I'm going to describe what they show. And then that way you can sort of have a general understanding of what a skin cancer looks like, and you'll be able to start practicing on yourself. This is squamous cell carcinoma. Squamous cell carcinoma is the most common skin cancer. It is generally crusty, sometimes ulcerated, sometimes often painful. And the thing about squamous cell cancer and the precursor actinic keratosis is that often you'll start getting something sort of scratchy on your face, and maybe you scratch it off or peel it off, and then it goes away, and then it comes back. And that can be benign or it can be something bad. The key is if it hurts, like if it's painful to scratch it away, then that's something to pay a little bit more attention to. If it starts to get sort of thickened, that's something to pay attention to. These are all different features that you should pay attention to and let a physician know if you see them, or a mid-level practitioner. This is basal cell carcinoma. Basal cell carcinoma is also sort of looks like a tumor and sometimes looks ulcerated, but it's more clear and translucent than a squamous cell. You can see all of these pictures, they're sort of shiny, almost like pearlescent. And they have these vessels that sometimes travel across them. Okay, so melanoma. Back to the original study that I described to you by Dr. Mim. He found that there are different features that you can apply to a lesion that's pigmented to decide if it's probably a melanoma or not. And we use the ABCDE method. A lot of dermatologists and primary practitioners talk about this, and you may have heard it before. I'm going to give you a little added bonus if you add the PER. So ABCDE PER. A is for asymmetry, B is for border, C is for color, D is for diameter, E is for evolving or changing, and PER stands for the patient, meaning if you go into any dermatologist's office and you tell them that something is bothering you, then they must further examine that. And if they don't, then I encourage you to push it harder, because the patient is always right. The U stands for ugly duckling, and the R stands for regression, which means that it was there and then it sort of got better or disappeared. Here's an example of some melanomas. You can see that all three of those, the melanoma on the top is asymmetric. The benign normal mole on the left is pretty round and pretty symmetric from side to side. The two on the bottom on the right, the middle and the right, are atypical. They have like a little knob here, a little notch there. They are not symmetric. B is for border. If the border is irregular, it has little like feet coming off of it or little notches, that's something to take a closer look at. So again, on the bottom row, the one on the left is a normal benign mole. It's pretty obvious where it starts and where it stops. And then the other two are progressively more atypical. So for color variation is an indication that something may be going awry. A benign mole or nevus is usually one color. The one in this example is sort of like a light tan red. The other ones have different colors, like black, brown. Sometimes they look sort of blue or purple. This is diameter. The diameter that we like to throw around is 6 millimeters. So anything under 6 millimeters is okay, but anything over 6 millimeters you can start to worry about. Of course, there's overlap, but as a general rule of thumb, this is pretty easy to remember because 6 millimeters is the size of a pencil eraser or a very nice solitary diamond. Okay, so these are all examples of nevi or moles that don't have atypia. You can see that even the largest one, has these sort of polka dots around the border, but it's really symmetrical and it looks pretty much the same throughout. There's a little bit of color variation, but really it looks pretty round. These are examples of melanoma. You can see the black spot next to that finger sort of has like, almost like little tentacles coming out around the side like a skirt. And then the one on the left, you can barely even see where it starts and where it ends. Here's another example of a couple of melanomas. They have variable color, they are variable shape, they are not symmetrical at all. And more melanomas. These ones have a lot of black to them. They may almost look like they're just a hemorrhagic bruise. And more melanomas, 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 melanomas. These are all things that should raise a red flag if you see them, and hopefully you'll never see one that is this progressed as the first person who's ever seen it. So I'm going to give you a pop quiz, and I realize that this is recorded, so no need to answer it. Just think about it in your mind. If you think that this lesion is benign, okay, or something to get checked out. This lesion is benign. It is a seborrheic keratosis, but what I would like you to know is that the answer for you is get it checked out. Anytime you see something that you are not sure of, ask somebody who knows a little bit more about it than you. And I have kind of a cute story to tell you about seborrheic keratoses. Seborrheic keratoses are also colloquially called barnacles or old age spots. And they are patches or plaques on your body that get kind of thickened and crusty and sometimes scaly. And usually they're the kinds of things that you bring in after the age of 30 or so to your doctor and ask to get removed, and they say that your insurance won't pay for it. And I still want them to get removed sometimes. One day when I was early on in my career here in San Luis Obispo, one of the women who worked in the lab came into my office. She was quite young, maybe 30, and she was pregnant. And she came in and she closed the door. And I was feeling a little bit uncomfortable about that because I didn't know what she was about to tell me. And what she said was, Dr. Moore, can you look at one of my moles because it is changing? And I thought, oh, talking about fear, what if this young pregnant mom had something really bad? Because I am a dermatopathologist and I see the worst of the worst. And that is where my mind went. So I said, yes, of course, you can show me. So she lifted up her shirt on her belly and she had a lesion that looked a little bit like this, but it was darker, like a dark, dark brown. And I looked at it, I didn't want to touch it. You know, I thought that was a little overboard. And I said, I think that it's okay, but I really think you should go get it checked out by your dermatologist. And so I didn't hear anything else about it for a while. So I assumed that either it was really bad or it was fine. 2 weeks later, she came back into my office and she said, Dr. Moore, I found out what that mole was. And I said, oh, really? What happened? And I was so excited to find out what the dermatologist had said. And she said, well, I went home that night and I picked at it and I realized it was a piece of chocolate. So always be mindful of what's on your skin. So I'm just going to end with a little bit of a pep talk about making sure that you take a look and that you don't feel afraid. Or if you do feel afraid, that you realize that that is okay and that is part of life, and that it just means that you're about to make a decision about something that could be important. And I'll bring you back to this famous prayer by Reinhold Niebuhr, which says, God, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. So I hope that by going over a little bit of what skin cancers look like, you can now, in some regard, know the difference. So skin cancer mindfulness, in summary, is being observant of your skin and the skin of others around you, knowing and appreciating that you're safe, secure, and you're alive in the moment, whether that means that this is you've never had a cancer or you've had multiple cancers in the past, and finding possible cancers without that fear or judgment that accompanies the thought of it. And lastly, just keeping an eye on them so that you can show them to the expert when you finally get to see them. And so what happens when you do find something? You talk to your doctor, or you talk to the mid-level who takes care of you. Dignity Health has a whole range of doctors. I've put the liberty of putting in the website so that if you don't have a doctor right now, you can peruse who's there and who's taking patients right now. Unfortunately, in our area, as well as in a lot of areas in the United States, the ability to see a dermatologist today or tomorrow is virtually impossible. I have talked to a lot of people in the area, and the wait at this point for a new patient, if a dermatologist is taking them, is like 8 months. If something like that happens to you and you have a real concern, and you know that you can always reach out to me, or you can have your primary care physician reach out to me to consult and try and get you a spot. It's really important in our area, especially with the current COVID situations, that a lot of people just decide that they'd rather just wait. And sometimes when they hear that there's an 8-month waiting period, they decide not to put their name down, and then they decide 6 months later to put their name down, and then they just lost 6 months. And I don't want that to happen to anybody in our community if you really do have a problem. The dermatologists who work with Dignity Dermatopathology, WDSL is our laboratory that we use, and with me, there are some who in the area who use us regularly, and if you need help figuring out who they are, then please give me a call or send me an email. You can always ask them to send their cases to me or to the Dignity Health System if that's the system that you would prefer to use. And so congratulations. Now you know some things. Let's see you strengthen and use your new skills and make a difference in Santa Maria and, of course, in San Luis Obispo County as well.